Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. As you know, our show is dedicated in the prevention and treatment of many different medical problems in a safe, healthy, and effective way. And safe is very important here. So, this show is going to be dedicated to heart disease and heart failure. Um, So very important show for people because it's such a common problem. Heart disease is the number one of the number one killers here around the world probably, but certainly here in the USA. Um, the key is always in the prevention, not in the treatment, in only in the treatment of it, but the key is always in the preventing of diseases and conditions. I know I'm moving up and down. I have a lot of techie things going on. All right. So let's start with thanking my sponsors, which are very important in the prevention and treatment of heart disease. First, PromoLife, PROMOLIFE.com. PromoLife, you would be getting home care ozone therapy, basically rectal insufflation, which is an ozone enema. We've talked about it on home care ozone shows. So you would contact PromoLife at 888-742-3404. 888-742-3404. Tell them you heard about it here on Dr. Howard's show. They'll give you a percentage off on getting set up for home care. And there you would be doing rectal insufflation, an ozone enema, um, probably every single day, particularly if you have a heart problem or if you want to keep your circulation clean and open as you're going to learn and prevent heart trouble. Very important. 888-742-3404. Remember to mention the show, and you want to get set up as you're going to learn a little bit more when we get into the show for home care ozone therapy. Um, then for everybody else, because there's something called the gut heart axis, go look it up. I didn't make these things up. Gut heart axis. Ask AI. It'll be happy to tell you what that's all about. The gut connects to everything. You're going to want to go to um, Doctor's Biome, DoctorsBiome.com, doctorsbiome.com. You want to order Doctor's Biome. It comes in a delicious 2-ounce shot bottle. Take it every day because by keeping a healthy gut, you will help keep a healthy heart and you can help repair your heart if you've had heart trouble. It's that important. One of the most important things you can do. And if you put in the code Howard35, you get 10% off the retail price. And I always tell my patients, go on auto ship. You get an additional 10% off the retail price. Now you're getting 20% off. It's not a cheap product, as you're going to learn. And yes, capsule powder and tablet probiotics are virtually 90 to 100% destroyed in the stomach. And this is created, their 15 patented proprietary strains are created to survive the stomach. They're called next generation probiotics. They're created to survive the stomach over 90%. So they're called smart bacteria. They're actually capable of sticking to the wall of your gut, killing off bad bacteria, getting yeast in balance. Very important to be taking Doctor's Biome every day, and it's delicious. All these patented strains are living in a 100% organic vegetable fruit juice. So if you go to doctorsbiome.com, DoctorsBiome.com, and order it, it comes with a 100% money back guarantee. You get free shipping anyway, but with priority, you'll get priority shipping if you go on auto ship. So not just an extra 10% saving, which is nice. It's big savings. But you'll also get priority shipping because it's sold all over the world. They run out all the time. And as soon as the next batch is released after safety testing from the independent lab, priority shipping goes to auto ships, as it should. Okay, so let's get right into the show. Heart disease is one of the major killers here in the US. It has been. I don't know if cancer is still probably number one, but heart disease ranks as number two after cancer. Bottom of it all is it is not only preventable, but it's treatable in a safe and effective way. Now, many people are genetically prone to heart disease. We're not going to get into all the causes of it. That would take an hour's worth of show all on its own. And these shows are dedicated, though these quickies, as I think of them, are dedicated to give you what can you do to prevent and treat heart disease and congestive heart failure in general. As you get older, and even when younger people have these heart problems, that's why people die from heart attacks at a young age. You haven't built up that collateral circulation, the fine blood circulation, and the main blood circulation to your heart has already been blocked up. Okay, we've done shows, or we will do shows on why that happens, but many people have, unfortunately, a genetic propensity to have their circulation clogged up and hardened. And we'll talk about how we're going to fix it, but and that's what this show is. So the first way to help in the prevention and treatment is to be on a healthy organic diet, particularly predominantly vegetables. I haven't eaten meat or chicken since January of 1980 when I gave it up. Today, there are so many substitutes. You never have to eat chicken or meat at all, and you can still be having chicken tasting food and meat products, burgers, and all sorts of stuff all the time. There was a paper written, published in the New England Journal of Medicine in January of 1980 by 6 colon cancer surgeons. And they claim that if you eat any amount of red meat at all, you stand a 66% chance of getting colon cancer. Well, it also means then that if you're eating any amount of red meat at all, you could be clogging your arteries up, even if it's lean meat. Okay? Because some people have receptor sites in their arterial system that take any cholesterol at all and turn it into the worst kind and clog themselves up. So I would avoid eating red meat or chicken, certainly chicken fat. Now, fish other than organic vegetables, fish is a way to go because particularly only non-farm raised fish like sardines and Alaskan salmon and halibut. Fish contain the omega-3, 5, and 7 fatty acids that can help cleanse arteries and open arteries up. A Mediterranean diet has also been shown to be beneficial in preventing heart disease, predominantly because most of the vegetables are grown locally. You want to try to be as organic as you possibly can. So fruits, vegetables, beans, and whole grains are the basis of any healthy organic diet, and that's the kind of diet that you should be on. Plants are loaded with bioflavonoids and flavonoids. Flavonoids are very powerful in as a supplement in treating this. Vitamin C, very important. Talk about colds. We just did a show on that, a two-parter on that. Vitamin C and vitamin E are very important in heart disease. Vitamin E, 200 to 800 IUs a day of the mixed tocopherols, tocopherols. That is what vitamin E is. So if you hear or see the word tocopherol, that is vitamin E. And you want to take mixed tocopherols, 200 to 800 units a day on a daily basis. Vitamin C, I recommend the 500 to 1,000 milligrams every 2 hours while you're awake. So if you're asleep for 12 hours, that's half the day, and you're up for 12 hours, you can take 5 or 6 doses because if you're taking a high quality vitamin C, let's say it's a liposomal C, if you're taking a high quality vitamin C so that it's bioabsorbable, and then bioavailable, meaning your cells can take it up out of your blood, and then bioutilizable, your cells can do something with it, Vitamin C is used up after 2 hours, urinated the rest away. So you have to constantly be replenishing it. And that's why I recommend 5 or 6 doses a day. A study in Journal of Nutrition shows that vitamin K3, menaquinone, can reduce the risk of coronary heart disease. Bioflavonoids, there are many studies that have been published showing that bioflavonoids, which are found in organic grapes, berries are great, cherries, currants, apricots, plums, but you can get bioflavonoids, 100, 200, 300 milligrams, 400 milligrams a day is plenty of that, depending on how old you are. Keep in mind, as we age, our digestive system ages with us. With us, so you want to have a digest. It isn't going to absorb everything like it did when we were teenagers and younger. So taking a little bit more without megadosing is smart. Then there's coenzyme Q10. Um, very, very beneficial for heart disease. Um, we mentioned why you should be taking essential fatty acids, but you got to stay away from fish oil because fish oil in capsules can go rancid and be very, very unhealthy. Vitamin B12 injections work. Orally, very hard to get because you have to try to absorb it from food. So very hard to do that. And cyanocobalamin, which is kind of available orally, to me is a complete waste. So you can find a doctor where you can go in and get an injection of methyl or hydroxycobalamin, 1,000 micrograms in an injection once a week is plenty. Might turn your urine. We give 5,000 milligrams in our office. Um, uh, because of the way I get it, it's just is inexpensive to do, and so taking B12 every week is very valuable to your heart. Um, Folic acid is a very important supplement to take for heart disease. L-carnitine is an important amino acid to take for heart disease. Lecithin helps clean out the blood along with L-carnitine. Uh, helps clean out the blood, the blood, red blood vessels, make the blood flow smoother, easier, and less viscous. Um, there's other supplements that can do that as well. Um, uh, because if you have an easier blood flow, you're less likely to have a heart problem develop. If blood flows smoother and easier and less viscous, that's where vitamin C is helpful. Um, you can get ginkgo biloba is helpful with that. Grapeseed extract is helpful with that. Um, these are things to help with blood flow. Um, Niacin is also helpful with blood flow, also known as vitamin B3. Sometimes it can cause a little bit of flushing, but you can get it in various forms. Take small doses at a time, and that can be helpful. Magnesium citrate, or most people are magnesium deficient. Magnesium glycinate is very good for the heart. Um, you need calcium, potassium uh, on a daily basis. You don't want to overdo calcium, but taking small amounts of supplements because keep in mind, your body will always maintain a close to normal calcium level. It's rare that someone is calcium deficient. Why? Because if you need more calcium, it robs it from your bone, and then you become osteoporotic. So, um, that's been shown beneficial. N-acetylcysteine is very good for the heart, along with resveratrol to help bring down chronic inflammation in the heart. Um, so these are some of the things that you can do. There are herbal therapies that you can add on, um, like reishi mushroom. Um, bugleweed, lily of the valley, celery seed, motherwort, tansy, alfalfa, lemon balm, Indian snake root, black cohosh. Um, uh, these are all, herbal supplements that have been very beneficial for the heart. Now, chelation therapy cleans out and opens up the circulation. Um, Intravenous ozone therapy done in the direct IV method, and you listen to our show called Intravenous Ozone Therapy, Everything You Need to Know, particularly Robin's method of DIV, has been proven to be extremely beneficial in helping in the prevention and treatment of heart disease. Now, I know you're not going to be able to see this, but I am going to play for you a patient of mine, and I want you to hear this. If you can't see it, I'm going to hold it up, but hopefully you'll be able to see and hear Peter, it's on my cell phone, talk about what happened to him. Now, he didn't come to us with heart disease, came for something else, but this is what occurred. Okay. Hi, this is Peter. He has something to relate to us, and it's okay if I film you, right?
Sure.
Okay, so why don't you tell us what went on?
Okay. 3 months ago, I had a heart attack. The hospital said that the bottom wall, the inferior wall of the heart, was beyond repair. It couldn't be restored. It wasn't working. And now, the other day, I just had an ultrasound, and it showed that that wall was working fully. It was restored back.
That's wonderful. What else?
And then when I left the hospital, my ejection rate, the blood from my heart, was 49%. And now it's 63%.
How old are you now?
I'm 74.
Wow. Thank you.
Sure.
Okay. So if you heard that, hopefully you did. He had a heart attack. The inferior wall of his heart was completely destroyed. They told him it'll never be good anymore. And he was getting ozone therapy for other reasons, and his heart, with the direct IV method, completely repaired in just 3 months, getting treatments just 3 times a week with Robin's method of direct IV, which is just absolutely amazing. And the ejection rate, that's how much blood is pumped out with each pump from your heart, increased from 49% to 63%. That's very, 50, let's see, 10, that's about a 12% increase. Now he's 82. So obviously it lasted. Now I just had to have a hip replaced, couldn't save it. 18 years of judo and 30 something years riding a horse and sleeping on that left side. It's just bone on bone, unrepairable in any other way except to replace the hip. And my heart, which is something I knew from years ago, has a couple of, had a particular issue. I call it an issue because it wasn't a problem. It was a Wolf Parkinson, a white Wolf Parkinson white wave, and then I had a T bundle that showed up, a little spike in that. So they put me through cardiac PET scan, echocardiogram again, just to make sure the heart was going to hold up for the surgery, even though I wasn't going to get anything other than local, general standby with IV sedation. Fact is, my heart was great. They couldn't believe how great my heart was with these issues. So these issues were non-issues. Why? Ozone therapy and the healthy diet that I live made a very big difference. Now, so intravenous ozone therapy is an amazing way of treating this. Now, I don't think I mentioned it, but boy, I should have. Exercise. You need regular cardiovascular aerobic exercise. 20 to 30 minutes at least 3 or 4 times a week. You don't need more than that, generally speaking, for most people, but 20 to 30 minutes, 3 to 4 times a week, where you get your heart rate up to between 70 and 80% of your maximal exercise heart rate. Now, what is that? What you do is you take the number 220, you subtract your age. Then you just multiply by zero point 0.7 and then zero point 0.8. And that's the number of beats per minute while you're doing aerobic cardiovascular exercise that you want to keep your heart in. Okay? Yeah, you can go higher, but that's not going to burn fat and clean out your arteries, help you control weight. But that's an aerobic level that's safe. So you're not putting yourself in harm's way by exercising too hard. And that can help keep that blood circulation flowing really, really well. So exercise, you can do light weights and things like that, but it's that cardiovascular exercise that can make a very big difference. Yoga can be beneficial to that. Um, Acupuncture is very valuable in heart disease and in the prevention of it even. So you're going to find that acupuncture is good. And if you want to get involved in a very gentle but very beneficial cardiovascular program, do Tai Chi. You can learn it now online. You can go for classes, but Tai Chi is a very beneficial exercise form um, in the treatment of heart disease. Um, Meditation, very important. Can't underestimate the power of the mind in the treatment and prevention of heart disease. Um, Getting what the right amount of sleep is very important in patients, in people that have this as a concern. Um, I recommend when people are younger going for cardiovascular stress testing at least every 2 or 3 years, having an echocardiogram at least every 3 years when you're younger. Once you start hitting, or even every 5 years, let's say, until you hit the age of 40, 50. Now, why do you want to do it? And I'm recommending every 2 to 5 years when you're younger, because if you have a problem then and you have a heart attack then, your chances of death are extremely high. Whereas as you get older, because you've been doing, cardio, you're walking and exercising, living your life, you have a greater chance of surviving that heart attack because you've been able to develop what's called collateral circulation. And you can look all these things up. I'm not here to teach you, teach you every little thing. And look up what is collateral circulation to your heart. And because of that, older people survive heart attacks better than younger people do. So if you don't know that you're all blocked up, how do you know? You go for an echocardiogram and it'll tell you that. You can go for a stress test, which basically tells you whether the electrical system to your heart is working correctly. And they have various ways of treating this in addition to keeping you safe and healthy. I am not recommending pharmaceuticals. If I had to recommend one pharmaceutical only, and that would be baby aspirin. Taking one baby aspirin a day, if it's not too irritating to your stomach, you can take it with food, can help keep that blood flow open as well. That's the only pharmaceutical that I recommend for heart disease and heart treatment. I always say go to an alternative functional medicine doctor who specializes in treating heart disease in a natural way, and they can often put you on the right supplements and whatnot to take if you don't know what to do based on just my giving you some little bit of guidance here on the show, or how much individuals. Notice I didn't give you amounts most of the time because everybody is an individual, and you can be tested to know how much of each of these things is important to do, except in the food where you can eat lots of all that stuff and be kept healthy that way. Um, Rectal insufflation is an ozone enema that can absorb some ozone into your blood, okay, other than getting Robin's method of direct intravenous ozone therapy, and that's the method you want to use. Other methods of ozone therapy are not the same, not going to give you the same benefits. I know the doctors are going to tell you they do. That's they're entitled to their opinion. I think I know better than them since I'm one of the biggest names in the world in what I do, ozone therapy. So, um, and I do blood methods of ozone. I just don't do that for heart, people who have heart trouble. I don't want to be taking blood out of your body, ozonating it and putting it back in. That's only going to strain your heart and make it work even harder. And that's why I am not a fan of the blood methods of ozone to treat heart disease, and heart failure at all. Okay. If you have questions, feel free to call my office in Manhattan at 212-581-0101. That's 212-581-0101. Email me at ozonedoctor, OZONEDOCTOR, at yahoo.com, ozonedoctor at yahoo.com. Contact PromoLife at 888-742-3404. Mention you heard it here on the show and you want to get set up for ozone home care. Okay. And then doctorsbiome.com, doctorsbiome.com. And remember to go on, use Howard 35 and go on auto ship to save 10 to 20% off your retail price, which is a big savings. Everybody stay safe, stay healthy, stay well, and please subscribe to our channel. Please let everybody know about it. Let people know maybe you don't need this show today, but you'll need it, or another show we've done today, but you may need it tomorrow and know somebody that would. Stay safe, stay healthy, stay well, and we'll be back again soon with another episode. Bye now.